Well, good morning, and thank you very much for joining us. I am Yori Folari. Today, let's go a bit local, by which I mean let's stay in Lagos State. We do go all over the place in terms of states, but today, coming back to the the Center of Excellence, there is indeed one other initiative of theirs, and it concerns health. We're talking about Health for All Residents of Lagos. It's a program by the Lagos State government, and they intend to cover it. It's they call it Ilera Eko. That's how they're marketing this particular idea, and the objective is to capture every resident of Lagos, so that it's a form of health insurance. But you know, we have the general manager of LASHMA, which is a very long form of Lagos State, Dr. Emmanuela Zamba. Dr. Emmanuela Zamba, I assure you, is a full-fledged Nigerian and Lagosian. Never mind, you might have thought that. Did you just say Emmanuela Zamba? Yeah, she is well known in her community. Good morning, doctor.
Good morning.
And thank you very, very much for coming on.
Thank you for having me.
Indeed. Now, the Lagos State Health Management Agency, which was the LASHMA that I was trying to say, that's your agency, and it is the one that is responsible for Ilera Eko.
Indeed.
Which is really I even made a note of it, because I was thinking that, look, you can interpret this in so many ways, but I think I made a note of it, and it says that it's a campaign to achieve universal health coverage for all Lagosians. But you can extend that to all residents of Lagos State.
Indeed.
Even if you're not a Lagosian. If you're a resident in Lagos State, then you aim to capture such people. How is it different? Let's start from there, from the National Health Insurance Scheme.
Thank you very much for the question. We are a state health insurance scheme, so we mirror what is happening to a large extent at the federal. And as you said, our mandate is to ensure that all residents of Lagos State have health insurance, regardless of their socioeconomic status or their ethnicity. As long as you live here, you are entitled to health insurance. Okay,
now, what is this going to take? Because healthcare is not known for being highly affordable, not to use the word cheap. So how is this going to work? Because everybody, first of all, it's free. I make that assertion. It is free.
It's not free.
I have been contradicted.
Nothing
it is
free
not
in
free.
Freetown.
There is no free lunch anywhere.
No, there isn't.
But that being the case, I noticed when I was, reading up on the subject matter that you've gone to great lengths to be as inclusive as you can be to make it as as affordable as can be. If need be, you even break it down, pay small.
Installmentally, exactly. So it is free for a proportion of Lagos residents, I would say that, because our governor, Mr. Babajide Olusola, who is someone that's very big on social protection and, looking after the welfare of the masses, we've set aside 1% of the Consolidated Revenue Fund of Lagos State, and that fund is called the Equity Fund, and it is specially meant to cover those people who are identified as vulnerable or indigent in Lagos, so that they get health insurance. In short, we pay subsidies for their own premiums, and then they can come under the scheme. But for everyone else, you need to pay.
Okay.
However, I would make a bold assertion to say that it is the most affordable that you can get. When you look at it first as the content of the services that we're providing, you can't get it any better anywhere, actually.
Okay.
And
now, before you get to the various packages, because I know, I don't know whether to refer to health matters as packages and marketing, but we do need to segment it, so I understand perfectly what you're saying. What is the content? Because you just spoke about the content of the initiative. What does it cover? Or does it cover all the health issues anybody is likely to get?
Okay, so health insurance never covers everything. I mean, but for us in Lagos, what was important was to look at our disease burden, look at the health needs, and come up with a package that would cover about 80% of what people would normally walk into a facility for. And that's what our standard package is all about. It's what we feel should be the basic minimum package for anyone that is living in Lagos. And to talk about the content, so most of the things in there a lot of it is primary care, but there is also secondary care. So things you'd walk in, I have a headache, I have fever, I have a cough, diarrhea, etc. Childhood illnesses, all those are covered under the scheme. We go a step further in that you can also get admitted under the scheme for about 15 days, and you can get feeding at least once a day under the scheme. Then also we do surgeries, so appendectomy, for instance, herniorrhaphy, that is also provided under the scheme. We're very big on maternal and child health, so your antenatal care, your delivery, whether it's by cesarean section or a normal delivery, is covered by the scheme. If you need a blood transfusion, that will also be sorted. We also look at non-communicable diseases such as hypertension, diabetes. If you're a sickler, for instance, you can join us. Asthmatic patients can also come under the scheme, etc. We also have, of course, you can do your lab tests. You can have an ultrasound scan when it's indicated. You can have your x-rays done, etc. As I said, 80% of what you normally, you can even get glasses.
Even glasses?
You can get glasses. You can see a dentist. You can also, we also have...
How about the eye doctors?
You can see,
that's the glasses part.
Yes, you can see, as I mentioned, you can see a dentist. We even have facility for you to get a percentage of your cancer care covered. But of course, there will be terms and conditions attached to that. But yes, you can actually get the scheme to provide some level of funding for whatever cancer care you would need. Once you have been with us for at least a year and you're renewing again, if you do come down with it, then there is some support that you get from the scheme. So there's a lot of benefits to coming to join us under the scheme, really, and for a paltry sum of 8,500 for an individual per year.
And a family, an individual and a family of 6? For
a family of 6, it's 40,000 for the year.
Okay.
So father, mother, and children under 23.
And 4 children.
4 children.
And then, you know, there are arrangements if there are more than 4 children, then...
You can now pay an additional sum of 6,000 or 8,500, depending on the age of the child.
You, when you were speaking about it, you had said that this is how it shall go, but you said all the things that in fact, I couldn't even think of anything else as you were covering all of that. But even, I imagine, orthopedic accidents, broken bones, and all of that?
Yes, emergencies are taken care of under the scheme, indeed, yes.
This part of why you're out now is to sensitize the public in Lagos that, look, this is available just in case you didn't know, and it is of great benefit to you. The informal sector, that must be knowing how things, the way it goes in Lagos. I imagine that the informal sector is very important to you because it's like government would be the final bus stop, last bus stop for them. Every other people can take a plane out to Israel or wherever, but for those that can't,
there is no other option.
There is no other option, and they will be taken care of, you know, professionally, very well, and certainly a lot better than themselves alone.
Indeed. So statistics tell us that about 70% of us in Lagos belong to the informal sector, and they are the largely uncovered residents in the population. Some of corporate Lagos is covered, but largely informal sector, there is hardly any cover there. And so you have to look at, that's one of the reasons why we even coined this as Ilera Eko. So it's something that they can relate with, they understand it, it's kind of like a call to action to prioritize your health, you know, and key into this to give yourself and your family a quality life. So that's how we came about the name. And we've tried to push into the grassroots. So we do have offices in the divisions of Lagos State. We have sales kiosks spread across the local governments and LCDs in Lagos State as well. So you can walk in and have yourself registered. We have a call center, which is 24 hours, and you can call us. It's toll free. So even if you have what they call flashing level as an informal sector person, you call us. We are not going to take over your flashing credits. We pay the bill, we talk to you, you ask for whatever you need, and we have you registered onto the scheme. So we try to make it as customer friendly, looking at the informal sector as the principal customer. As you said, we even have the Pay Small Small, which is the installmental version. So for 1,000 naira per month, you can join the scheme and you start to enjoy the same benefits as someone that paid one-off, really. So those are the things that we're putting in place to help us. We're currently working on a USSD. So even if you have a balasa phone, as they say, it's easy for you to sit in your house and just press and make your payments, etc.
Now, being part of Ilera Eko as a scheme, this covers registration and consultation. Now, I want to understand what that means. And because you go to any private hospital in Lagos, I mean any hospital, you have to register. There's a fee for that. And then maybe they will even ask you for consultation. So I wanted to ask, does this hold true for whatever hospital is closest to the person that they go to? And when they're asked, say, look, you have to register, you need a card and all of that, you can just flash your, the fact that your ID that you are part of Ilera Eko, and that should do it.
Yeah, so registration and consultation is covered, as you said. Once you've made your payments, you get your policy number sent to you on your phone, and you can also get an ID card. So when you walk into the facility that you've chosen, it's IT-based, we're IT-based end-to-end to try and reduce cost and make us more efficient. And so once you go in, you give them your policy number, they check on the system. Once you're activated, you have access to a doctor. You don't need to pay any extra fees of any kind.
When the information I have is coming from a release that you put out there on the internet that's dated the 21st of February. 11th of February. Now, how long has this scheme been in operation, or is it still at the planning stage?
So we've actually launched out fully since 2020. I'd say middle of 2020. We first started by onboarding the public servants in Lagos State, who Mr. Governor has graciously agreed to pay 75% of the premium for them, and 25% is taken from our salaries, because I am a civil servant as well. So
20% did you say?
25% of the premium is being paid by the civil servant, and 75% is being funded by the government. So we started with that, and then we've now moved out into the general public. So we do have people from the general public that are part of the scheme. And as I mentioned about the vulnerables, we do have vulnerables that we are currently paying their premiums for that are also on the scheme.
The elderly are also, because that's another key area. The elderly, it seems to me, you would have, if you're planning for babies and vulnerable people in society, how does it work with the elderly? Okay,
so interesting question. Generally speaking, elderly is a high-risk population that, the insurance community are very wary about interacting with. But because we're a social plan, that simply means that you're there for the masses, for everybody and anybody. We don't discriminate. So whether you're 60, 80, 90, whether you have a pre-existing condition, etc., those things don't matter. Once whatever you need is under the benefit package, we welcome you into Ilera Eko. So we do have a plan specifically for seniors, which we call our seniors plan. So anybody above 60 can key into that particular plan. And apart from the things you would enjoy from the standard plan, we also have like a yearly screening that's added on for them, so they can walk into.
Cost.
Of course, it's an extra cost. So it costs a bit higher. That is for 34,000 per year per person. But for couples, it's 65,000. So we give a discount of 3,000 naira to husband and wife. And as I said, you go into the diagnostic centers we partner with, and you have those screenings done for you for the year. So you're sure of your health status as you move into the next year. So that is something. And we do have quite a few seniors that have bought into that plan, including the retired public servants are also some of our clients. And some of the NGOs that work with the seniors have also bought for some of those that are indigent, and some people have just walked up to us and bought for themselves and their wives or spouses, as the case may be.
And okay, Bilkis, good morning to you.
Good morning, Mr. Yori.
Good morning, Bilkis.
Good morning,
you had a question. Go right ahead, please.
Thank you. Doctor, I appreciate the topic you're talking about. I'm a civil servant, and I'm also enjoying the LHIS. But the question I have is that we are only been allowed to pick one hospital. If I pick the hospital and I want to go to meet a dentist, which is not under the hospital, will I need to pick another hospital, or how will I go about it? Will I be able to use the NHIS policy number in another hospital, which I've not picked before? That is, the person is a dentist. I'm using it under a normal hospital, which is just the normal hospital. And I want to see a dentist. How will I not go about it? So I need to answer that. Thank you.
Okay. Do I answer it immediately?
Yeah, please.
Okay, so thank you, Bilkis, for the question. Some of our hospitals actually do have dental care already in that facility. So if you picked a hospital that does not have dental care, all they do is send us a notice, and we have you referred to a hospital or a dentist that is near that hospital for your convenience, and you walk in there and we pick the bill. So it's as simple as that. We have, as I said, we're IT based, so they send us a notice via the platform, and we give approval for you to go ahead, and then you're referred to the dentist. You have your session done, and we pick the bills afterwards. It's as simple as that. You don't use another policy number because since it's IT based, the same number everywhere you go.
Very interesting. Talking about dentistry, which Bilkis wanted to know about, there are aspects of it. Does it cover everything under dentistry, prosthetics, you know?
No. So you can have extractions done. Simple extractions can be done. You can do your scaling and polishing.
Okay.
You can have a dental x-ray when it's necessary. And we do some elements of dental filling. That's about it, which I think is pretty much.
Okay, that's about it. You need any prosthetics? No, that's different.
Nah, you'd have to pay out of pocket for that.
You're on your own there.
Yeah.
Did I hear, say it again, please, I can't hear. Okay, Mr. Tunde Olowu, good morning to you, sir.
Good morning, sir. Good morning, Yori.
Good morning, sir. Please go ahead.
I want to ask the madam on the young with you then. What are the criteria for the program?
What do you mean criteria? Because we started trying to explain. Were you with us from the beginning?
No, I wasn't.
You see now. Okay, maybe the doctor will be able, Dr. Zamba, Dr. Emmanuela Zamba, maybe she'll be able to summarize it.
Mr. Olowu, do you live in Lagos?
Yes, I live in Lagos.
So that's already ticked. What we need is that you live in Lagos. That's it. We don't care how old you are. We don't care where you work. We don't care if you have any pre-existing conditions, yes, etc. Whatever, as long as you live here and you can show evidence that you live here, maybe your rent, or you have a LASHMA ID, for instance, or you've just recently paid your NEPA bill and it shows your address and all that. That's all we need to show that you live in Lagos, and you're very welcome to Ilera Eko.
Is that clear? I mean, are you good? He's gone. He's so happy. He's gone without even thanking you. But because you wanted to know, and that's why Dr. Zamba is out here today. It's a program she told us that actually they've been operative from 2020.
Indeed.
How far have you gone in terms of what you wanted to do in terms of percentages? That is to say, 50%, 80%. What's the general kind of an idea?
So the target is everybody.
Yes.
the law says you have to have insurance cover once you live in Lagos. We do know that some people already have private health insurance cover, so they are also counted. And then there are those that have federal cover, for instance, under NHIS. And then there is the state health insurance scheme, which is Ilera Eko. So our target is 100%. But right now, we have about 600,000 Lagos residents already on the scheme. That includes the public servants, some members of the general public, and also some vulnerable members of the state.
In order to understand that figure, what's the figure of eligible residents, of which 600,000 are already in the net?
So we know that we have a population of maybe about 24 million, right? Out of that, we feel that the private health insurance, which we're currently collecting data on, would have about 2 million of those, or 2 million plus of those already under private health insurance. And then also NHIS, maybe another 1 million in Lagos, that is. So you can see that we're still a long way ahead.
But you're ready for the task.
Oh, we are ready for the task.
Mr. Adeumi in Isolo. Good morning to you, sir.
Good morning.
Go right ahead, please.
I live in Lagos. How do I claim? Because I heard that if you live in Lagos, you have your proof that you live in Lagos. Is that enough to? How do I claim? What do I do to claim?
Okay.
Okay, Mr. Adeumi, thank you for calling.
Thank you, Mr. Adeumi from Isolo. So I don't know where you live. But as I mentioned, we have divisional offices in the 5 divisions of Lagos State. I don't know how we will transmit that information, but it is doable, as well as the location of the sales kiosk. However, the simplest way for you would be to call our toll-free lines. It's 24 hours, our customer center, and the numbers are 0800 Ask LASHMA and 0700 Ilera Eko. If you want me to break that down into the numbers, then that is 0800 275 527 462. I'll take it again. 0800 275 527 462. That's 0800 Ask LASHMA.
It's a special number.
It is.
It's much
toll-free.
longer.
Yes, it's toll-free. So you call us, we pick up the bill.
This goes beyond 11 digits.
Yes, it does.
So I hope you got it. 080. In fact, the way the doctor said it, 0800 275 527 462. Maybe now you've heard it about 4 times. So now this is. You said it at the top that this is something very close to Governor Sanwo-Olu's heart, and
yes, indeed.
This is part of the themes THEMES agenda of the governor. That was like a roadmap, a road plan, even before he came into office during the campaign days when we wanted to know. So what are you going to do exactly when you get there? This was, the document, and now this is actually part of it.
Part of it, indeed.
Okay. Maybe a question from Arochukwu in Imo State. Good morning, Mazi.
Arochukwu in Imo State.
Good morning, sir. Good morning.
Good morning.
Dr. Zamba.
Friends from Arochukwu. Arochukwu, not from Imo. Arochukwu is in Abia State.
Arochukwu in Abia State. My bad. So sorry, Dr. Abia.
Good morning, sir.
Yes, sir.
Yes. Madam, I want to find out from the health facilities, thank God for the Lagos State government initiative. Does it cover operation for Lagosians and also cancer patients? You see, sometimes we see all these facilities available, but when you go to the clinic, they will tell you they have specific, I repeat, they have specific ailments to cater for. That is it generally or exceptionally? Thank you very much. I thank the Lagos State government for what they have been shaping. Other governors should also copy such things to help people, because the level of poverty and the level of hunger is too much in Nigeria. Thank you very much. Happy Easter.
Thank you, Mazi.
Thank you, sir, for the question. So yes, we do cover some operations, not all operations. And I mentioned a few of them. I mentioned appendicectomy and I mentioned herniorrhaphy. With regards to cancer patients, so we know that that is a very capital intensive thing for most people. And so if we are going to be socially responsible, we have to have something that would support people on that sort of journey. So once you've been with us for about a year, once you've been with us for a year and you're renewing, if that sort of thing comes, unfortunately, your way, we have a facility to be able to provide cover for that sort of person up to about 1 million under the standard plan and 2 million under the standard plus. So whatever cost the your oncologist gives you, that amount would be covered by health insurance.
Okay, going back to Isolo, we got a call from there. Now it's Temi Tokwe. Good morning, Temi Tokwe, coming in from Isolo.
Good morning.
Go ahead and ask your question, please.
Okay, please, I want the doctor to enlighten me more on. Yeah, I want the doctor to enlighten me more on the program, what it's all about. Then again, because I have a sickle cell child, I would like to register.
Okay.
So what's the process?
Okay,
I don't understand. I just joined the
you joined us late. You joined us late, right? You didn't join us from the beginning of the program.
Yeah.
Okay, so
we'll
prevail on Dr. Zamba to reverse a bit, please. Now the lady said she has a child who
is sickle cell.
Is a sickler, and that's why she wants to know.
Okay, so thank you, Temi Tokwe, for calling in. As I mentioned before, we know that we have a huge population of sickle cell patients living with us in Lagos. So part of the plan has some elements of the care for a sickle cell patient. So you would do well to register with us. At least this scheme, even if you cannot cover all your bills, would be able to cover a significant amount of those bills. How do you join us? So I can read out the numbers for you again. All you do is just call them. They will tell you the divisional office or kiosk that is closest to you, or you can visit our head office, or go on website if you're IT savvy and register yourself and your child on the family plan. So the numbers once again.
Okay.
Okay, so we have 0800 275 527 462. There is another line. That one is 0700 Ilera Eko, and I'll break that down as well. So we have 0700 453 723 56. Any one of those numbers you call any time of the day, any day of the week, there will be someone to pick your call and walk you through what you need to do to join us.
Thank you, Doctor. Just in case, these are special numbers. Usually you're used to your 11-digit GSM number, but these are special numbers. The first one the doctor gave was 0800 275 527 462. And then the other one she gave is 0800 453 723 56. I beg your pardon, 56. The last two digits being 56. Once more, 0700 453 723 56. Okay, we'll take a break now. Stay with us, please. We'll be right back. We'll continue to take your calls. Okay, welcome back, and our guest this morning is Dr. Emmanuela Zamba. She is General Manager, Lagos State Health Management Agency, LASHMA. I hear it is called. I tried to say LASHMA. They said, don't stress yourself. It's LASHMA. Okay, just distinguish it from LASHMA, I imagine. Okay, and we've been talking about, trying Lagos State wanting to capture as many people as possible in its health for all. In fact, they even have the policy of no person left behind. But before I go ahead, Sonny, Kehinde Sonny is on the line. Good morning, Kehinde Sonny.
Hello, good morning.
Thank you for calling in. Go ahead with your question, please.
Yeah, good morning, Uncle Yori Folani.
Good morning, sir. Okay. You got a question for Dr. Zamba?
Yeah, good morning, Uncle Yori. How are you, Dr. Zamba? Good morning.
Good morning.
Please go ahead. Don't listen to yourself.
My name is Alaji Kehinde Sonny.
Alaji Kehinde Sonny, you are very welcome, sir. Please don't listen to yourself. Just continue. Oh, in Magodo. That's fine.
Yes. The question I want to ask the doctor, this program, can an association like all students, can they participate?
Oh, yes.
There are no student association. Can they key in into the program? Question I want to ask the doctor.
That's excellent. Thank you very much. The doctor will answer you. Thank you for calling in, Alaji Sonny.
Thank you very much, Alaji, for the question. You are very welcome. We are very big on groups and associations joining us. It's of great benefit to you if you come our way. If you want to leave a contact number or something, call back to the station. I will have a sales manager or a sales team come over to your association and sit down, talk to your people and get people enrolled. We have a roving sales team, a huge sales force, field force all over Lagos. So just let us know where you are, when you want us to come. We're at your doorstep.
Alaji Kehinde Sonny. Alaji Kehinde Sonny.
Oh, it seems he's dropped off.
He isn't there anymore? Because there was some very valuable information in there. Alaji Sonny? He's gone.
Oh, dear.
Oh, dear. Okay. I was going to help out a bit and say, look, give us the number you want to be contacted on, because the doctor just said she'd get a salesperson to reach you, and that would have made life very, very simple. But
he can always call in, I guess.
You had gone. Adegoke in Ifako. Good morning.
Good morning. Please, I want to talk to the doctor.
Go ahead and do so, please.
This health insurance. Yes. Good morning, sir. Uncle Fola, I want to talk to the doctor.
Good morning, ma. I'm listening.
Good morning, ma. This health insurance, yes, I did one, and I'm at Ilera Eko General Hospital.
Okay.
When I did it, they told me that I is not part of the thing, that's part of the insurance. Then, whenever we want to collect drugs, they don't give us drugs. By last clinic, I went there, they said we should go to the to our doctor to collect, to try to write it in the computer. But the doctor said they cannot write. As a result, they didn't give me the remaining drugs for the week, for the month. And I'm not the only person. That there were about 5 who met in the medical clinic that day. With the up till now, they did not give us medicine. They are just closing up and down.
Thank you for calling in, ma'am.
Okay.
Yes, the doctor heard you.
Yes, I will respond, ma'am.
Your issue.
Okay, thank you, Mrs. Adegoke from Ifako. You said not part of the insurance. Actually, we started the eye care inclusion after we launched our products. So before February, you wouldn't have been able to access that. It's from now, since February 1st, that has become part of our package. That's one. Then you talked about not all the drugs being given. So as I said, the benefit package doesn't cover every single thing. So there might be the possibility that some of the drugs you required are not under the benefit package, in which case you would have to pay out of pocket. That is not to say that sometimes there might be some errors at the facility level whereby it is in there, but they say it's not in there. And that's why we have the customer call center. Right there in the facility, as this issue is happening and you have issues, you call immediately. They will pick your call and address the issue. Once we have identified that this drug in question is under the package, they will be made to provide that drug to you. Now, I don't understand what you meant by the doctor said they wouldn't key it in, but for me, that is a bona fide complaint. So you are free to call us from this minute on the call center lines that I gave you and register your complaints, which will be investigated and resolved. please do not forget, if you're not satisfied with the provider that you are currently with, you are at liberty to change your facility. Just because you picked that person at the beginning of when you register does not mean you have to stay with that person till the end.
Okay.
If you are going in there for some reason, you don't like the service, or you've moved, for instance, some people just move location, and so obviously you won't use the same facility as you were using. So you just send us an email or an SMS to the call center, and they will have your hospital changed for you. What was the other thing I wanted to talk about? She said, okay, so complaints, please, ma, just bear in mind, when something happens when you go and access service, call immediately, and someone will pick your call and sort you out. We are very big on quality, and we want our customers to be satisfied. But if you don't tell us, we don't know, and we can't do anything about it.
And they can use the 2 numbers
They can use the 2 numbers. As I said, it's 24 hours.
Yes. Okay. Ngozi in Badagry, good morning to you. Thank you for holding on. Go ahead now.
Good morning, Dr. Zimba. Please, those of us from Badagry.
Badagry.
How do we assess this Ilera Eko?
Ilera Eko.
The health of Lagos.
Because Ilera Eko is something else.
Entirely. Opposite, actually.
But no, that was just a joke. Of course, we understood what you meant.
Okay, so coincidentally, ma, if you live in Badagry, our divisional office is situated within the compound of Badagry General Hospital. So you just walk into Badagry General Hospital and you will see the divisional office. That office is open Mondays to Fridays from 9 to 5, and on Saturdays they open until 12 noon. So you can walk in and have yourself registered. They'll walk you and talk you through everything you need to do. They will register you. Once you've made your payments, you get your ID card, and you're one of us. Indeed. So welcome in advance to Ilera Eko.
You see, that's how inviting and welcoming this Ilera Eko scheme is. Now, another aspect that I think people will be interested to know about is something we were speaking about when we went off air, for the break. You're talking about something of a sub-scheme, health to wealth.
Indeed.
That is to say, if you already are registered, you can now refer other people. And for all those that you refer, you will get a commission. It does, and there's no limit to the number of people you can actually refer to this particular service. Tell us about that, Doctor.
Yes. So we know that as a people, we love incentives. It makes us do more or stretch more, so to speak. And we feel that while you are enjoying cover under the health scheme, what else can we do to provide some level of incentive for you to stay under the umbrella of the health scheme and also bring more people on board? So we have factored in a commission. When you bring someone in and that person comes in under the Pay Small Small scheme, we'll give you a referral card. If you walk into our offices, one of our offices, they'll give you a referral card. So for everybody that you refer, you record that into that book. When that person goes to make their payments, they mention your name, it's tied. As I said, we are IT based. So we'll have all that information. And once that person has made their payment, you get your commission. It's as simple as that.
Just like that. I mean, you don't wait for it to bulk up.
No. Once that person has made their payments, you are now what we call an independent agent. So you send your name, your bank account number, and so all those sort of things, and we register you under our independent agents.
Okay.
And once somebody comes and is brought through you, you earn your commission from that person joining us.
Good morning, Mr. George.
Good morning, Uncle Yori, and good morning to your guest.
Dr. Emmanuela Zamba.
Yes. Uncle Yori, I've heard of this program before, and somebody had explained it to me with the details. It's very good, but the suggestion I have is that you know that there are so many people that die from ordinary malaria just because they do not have the money to treat malaria. Many people do die like that. I want to suggest if the Lagos state government, if this idea can be sold to the government, let them lower the premium and make it compulsory for families in Lagos. For example, if you have to get admitted to any school, whether primary, secondary, or tertiary, you have to have that insurance cover. Since the National health insurance scheme has failed. The federal government tried it. It didn't work. Let Lagos do this one at the state level and see how it can work. I believe if they make it compulsory and lower the premium and promote it properly with the agency that this lady is handling, they will succeed. It's just a suggestion. Thank you.
Thank you, Mr. George. The 8,500 premium for adults, there's the suggestion that it could be lowered. Your response to that?
Thank you very much, Mr. George. I can see that you are someone that is very social welfare oriented, which Lagos State is all about. I would say that careful thought and science went into picking that amount. So there's the actuarial scientists who sat down to look at, after we had come up with what we call the disease burden in Lagos, what are the things that people would usually go there for? It's very possible to lower this. But then what it means is that we're going to shrink the services. And then that will kind of exclude some people from some cover, which is very common and something that, you know, why would we leave it out? So this figure was arrived at through science, looking at what are the services we're going to provide and what is the barest minimum that we can afford. The only way this kind of amount can go down and we still retain the services or even add some things in is when we have a huge number of people in Lagos. So the pool is massive, and we have a mix of
benefit from economies of scale.
Exactly. Then we can now reduce that cost, and we can even add some services on there with, you know, the actuarial scientists' advice. But I do take the point of making this compulsory. I would tell you that there is a law that says it is mandatory for you to have cover in Lagos State. We are currently working on some sort of legislation that would come out, an executive order that would come out and make that sort of thing mandatory. So if you want to go to school, for instance, you have to provide evidence of insurance cover for you and your child. You want to renew your driver's license, you need to show insurance cover, etc. So that is the next stage that we're working on. And so it looks like Mr. George is thinking, and I think you're part of Ilera Eko already.
And on their website, they say, quote, "The fee is very affordable. It covers registration and consultation, child sickness, chronic disease, emergency care, care of women and newborn baby, admission for at least 15 days, and drugs, among others." You know, there are more. Exactly. Folani in Idimo, good morning to you, sir. Well, I was told there was a Folani in Idimo wanting to ask the doctor a question. Did we lose Folani in Idimo?
Yes. Good morning, Mr. Folani.
Good morning, Mr. Folani.
Emmanuela.
Good
my
morning.
question goes like this. My question goes like this. I'm living in a Idimo area. Which hospital and I register for this health insurance?
Well,
we have...
maybe as part of that, you'll also give us the website. Can they check that kind of information?
Yes.
But go ahead,
also. Okay. So, Mr. Folari from Idimu, thank you for your question. We have a total of about 250 hospitals spread across Lagos, both public and private hospitals that you can choose from, and it's entirely your choice. So I wouldn't want to now say, go, and it will be as if I'm marketing for a particular hospital, which I shouldn't do. So what we can do for you, I can share our WhatsApp number with you. If you send them a message, they will send you the list of the hospitals that you can look at and make your choice. So the WhatsApp numbers are 070 453
Please continue.
58275. There are two of them, so let me give you the second one. 070 461 600 and then 51.
600.
Don't worry, Mr. Folani. I'll say it again so that you can get it. The WhatsApp number that the doctor just gave, that you can ask a question and you'll be responded to. You ready now? The first one she gave was 0704 535-8275. That's the first one she gave. The other one she gave was 070-461-651. Mr. Folani, I hope we were able to help you out there. Did you get, well, Mr. Folani has gone, but he seemed...
I'm sure he was practically trying to take
but let me just say it one more time, Mr. Folani. For the WhatsApp, 0704-535-8275. And then the other one Dr. Zamba gave us was... sorry, did I say Dr. Zamba? Zamba. I went Dr. Zamba. I must make the M sound. The second one the doctor gave us was 070-461-651. Now that's a WhatsApp number. So if you were to, text, ask a question, chat, you can even chat.
Yeah.
But can they also do a text and ask a question?
Oh, yes.
So that can be very, very helpful because a specialist at the other end will, let you know all that you need to know. Well, I mean, I must say that you've actually spread it in between the special numbers that we spoke about, that is to say, when you're actually engaging with the service, and if you had any inquiry or any area that is slightly opaque, you can call those two numbers that you gave us earlier. Those two numbers the doctor gave us, 0800-275-527-462. And then the other one that the doctor gave us in that regard is 0700-453-72356. Those two numbers are for, the centers themselves. If you're engaging and you have any complaint, issue, inquiry, somebody said something, you want to double check it, those two numbers are the ones to call. The earlier two numbers that the doctor gave, that's for WhatsApp specifically, and they will be able to answer anything that you want to know. Did you want to add anything to that? Because it's, Mr. George called in, and clearly Mr. George is sold on the matter. Apart from that aspect of, could you reduce it and then enforce it? And you did explain that, look, there's so many things going on in there. It's probably not going to benefit the public to reduce it because that would shrink the basket, so to speak.
Exactly.
But then you did say that if it really catches on and very many people do come on board, then economies of scale will kick in, and it is possible that it would the numbers would go down. Well, I wanted to thank you, Doctor, because I can't think of, and you've been so comprehensive. You've covered the entire ground. Dr. Emmanuela Zamba is General Manager, Lagos State Health Management Agency, and you said this has been in place since 2020. Yes. There's a long way to go, but you have about 600,000 people that have already registered.
Indeed.
I think that's just admirable. As Mazi Okorafor was saying from Aruchuku, as he was pulling his ear for other governors. Say, you people are seeing it, or other governors should just latch on. Oh. Thank you very much, Dr. Zamba.
Thank you for
coming
having
on this
me.
morning.
Thank
Our
you.
pleasure. Okay, so that's our program today. Please join us tomorrow for a fresh edition. I am Iori Folani. Bye-bye for now.